Danish drug maker Novo Nordisk has just launched its blockbuster diabetes drug Ozempic in India, one of the most anticipated pharma launches in recent years. The company has also cut prices of its anti-obesity drug Wegovy to gain market share, pointing out at a far more competitive phase ahead. As the competition in obesity and metabolic care is intensifying and key patents are nearing expiry, how is Novo Nordisk planning its next phase of growth, especially in a price-sensitive market like India? How does it plan to stay ahead of competitors in market across the globe, and what lies ahead after Ozempic? We put those questions to Emil Kongshøj Larsen, Executive Vice President for International Operations at Novo Nordisk. Emil, many thanks for speaking to Business Today. It's a pleasure to have you on the program. So I would like to start off by asking you about the Indian market. So Novo Nordisk has just launched Ozempic here, and you have also adjusted pricing on Wegovy. So how important is India to Novo Nordisk's global growth plans, and what are your key priorities in this market over the next few years?
Well, we have a company ambition of changing health at scale globally and reaching many more patients, particularly with our GLP-1 portfolio, of which Ozempic is the leading brand. You cannot change global health without having big ambitions for India with such a sizable population, but also large unmet needs in obesity. India, of course, is still in the early stages of obesity compared to many other countries, but now is then the opportunity to turn the tide of obesity so we don't get all the side effects of development that we've seen in Europe and the US.
Okay, so Emil, Semaglutide has basically reshaped obesity and diabetes care worldwide, and the key patents are now nearing expiry. How is your company thinking about expanding and defending its Semaglutide portfolio in India across the diabetes and obesity as the competition is increasing?
Well, India is a good example of a dual strategy where we both are in the very midst of launching Ozempic, but we're also partnering with leading local companies to bring authorized generics to Indians in every corner of the country. I was very proud yesterday to meet the CEO and leadership team of Emcure, our chosen partner for Povestra, which is our obesity brand within GLP-1. And I'm sure they will do a phenomenal job of launching across all tiers of Indian society and addressing affordability issues together with us. So it's a dual strategy. We collaborate with the strongest local partners you can think of, and we go ourselves with our leading brands as well.
Okay, so the obesity space, we are seeing that it is increasingly crowded now, with a lot of global pharma players are investing heavily into it. So how does Novo Nordisk view this intensifying competition, and what do you believe clearly differentiates your position and your approach as the focus moves on, beyond the weight loss to broader metabolic health?
Yeah, we welcome competition. That keeps us sharp, and of course we always aim for pole position. We were the pioneers in obesity and GLP-1. So what our strategy is, as I said, it is to partner with the best, but also to go ourselves so we can really address access to care for all Indians, no matter where they live in the country. What also sets us apart, of course, is the vast number of patients who have been experiencing the semaglutide drugs produced by Novo Nordisk. We have 38 million patient years worth of experience with semaglutide across the globe. So that sort of safety track record, I think, is great assurance for patients that we have the safety data set like no one else in the industry.
Okay, Emil, India it's a large population and it's a very big market. What is your strategy to make the drugs affordable and to make access of this particular drug to all of the Indians, wherein there is an uneven access to care? So what are the partnerships in place, and what are the strategies in place that will help you gain market share and improve access in India?
Yeah, but I think we see first and foremost the right price. We recently lowered the price of our obesity medicine with 37%, and we can see the very positive response in the markets to that. But it's also educating doctors, educating patients about obesity and the opportunities to treat, but also prevent, of course, because they go hand in hand. And then with the scale of the country, we need to have more feet on the ground. So that's why we have local partners, and we've also expanded our own footprint in GLP-1 across the whole country. So that's one approach. The other is online. We think it's key to be present online, because some patients, we've learned from the UK and other countries, they prefer consultations online, and they appreciate frictionless service and last mile delivery. So it's both, the traditional face-to-face interactions that are key in a market such as India, but it's definitely also online, where we're very happy to partner with Tata 1mg, with Healthify, etc. And I've been very, very impressed with the patient focus and of course also the online savviness of our partners here. I think they will play a big role both when it comes to education and easy access to the right medicine for individual patients across the country.
Okay, having said that, globally the obesity market has grown much faster than anyone expected, and with Novo Nordisk and Eli Lilly emerging as the two dominant players, how do you assess Novo Nordisk's position compared with Lilly across global markets, and where do you see the next phase of competition playing out?
But it's fiercely competitive. We respect all our competitors, including Lilly. For us, it's a matter of communicating the unique profiles of our GLP-1s. You mentioned the name Ozempic before. The track record we have with unique glucose lowering, effectively addressing weight management and lowering weight, which is critical in this space, but also a unique profile when it comes to protecting the heart, the liver, the kidneys, etc. So cardiovascular protection is key for people with obesity and people with diabetes. It's actually one of the leading causes of death here. So we provide a near instant improvement in CV outcomes with semaglutide, and we have some of the strongest clinical trials in this space. Many of them actually also conducted in India, where we have 10% of our global clinical trial footprint. So we're very proud of that, proving it not only globally, but also here on the home turf in India, where we have such a strong organization.
We are also looking at a better expansion of portfolio. So Novo Nordisk work on semaglutide for Alzheimer's has come to an end. So from a pipeline and innovation standpoint, what is the next big area the company is focusing on, and how soon can we expect meaningful progress?
Now, we will, without revealing too much, continue to launch innovation into India. It can be higher doses, it can be all forms, also in the coming years, just as we do now. We're also working on the pipeline where, diabetes and obesity are complex diseases. Some patients will look for even higher weight loss than we currently provide. Some will look for, as I said, more convenience, all forms. Some might experience side effects that we want to mitigate. So this is an evolving space with hundreds of millions of people suffering from a disease that can shorten lifespan. So we are just in the early innings of providing innovation to patients at affordable prices, but also pushing the boundaries of what medicine can do.
Okay, I would also like to ask you that Novo Nordisk has gone through a global leadership realignment at a time when the expectations from the company are exceptionally high. How do you see this shaping Novo Nordisk's strategy, culture, and long-term direction?
Yeah, we are a 100-year-old company, and the company is of course stronger than any individual leader or colleague, and that is also true going forward. We have a new CEO who actually used to have the job that I have now, and I think it's to the benefit of countries such as India that we have a CEO who has been visiting this country multiple times, who intimately knows not only developing countries but also emerging economies such as India and the reality on the ground and the need to serve patients at all affordability levels and collaborate with local partners to basically give the best possible support to doctors and patients. So I think that kind of mindset will serve the company well, but also what we call international operations, which is everything outside the United States.
Emil, would you also like to tell us about the newer products in obesity segment? Because it is injectables which is available right now. What else is in the pipeline, if you can share with our viewers?
Yeah, we are launching all forms of semaglutide at the moment. We already have an all form for diabetes care available in India, so that's available here. We are looking at higher doses of the same tablet in obesity. That is also going to come to India. I cannot reveal the timeline right now. We are busy with Ozempic, as you mentioned, but that's one avenue. But then we have combination molecules, what we call dual agonists or triple agonists in our pipeline to be launched relatively soon, particularly the dual option that has both an amylin component and semaglutide in it. So as a combined treatment, that's going to be launched relatively soon in the United States and in Europe, and will also come to India. So we are not stopping. As I said, we were pioneers in this field, and we aim to keep pushing the boundaries also in the future, with strong support also from medical teams and research teams and development teams here in India.
And what are the expectations with the Ozempic launch here? How are you looking at the sales going forward?
But this is, of course, a global blockbuster. It's become a mega brand, the best known brand in global pharma. We have very, very high ambitions here in India as well. It is a unique opportunity to address, both blood glucose lowering and the need for that, weight management and cardiovascular protection, where we have proven that we have reduced major cardiovascular events, so heart attacks, strokes, etc., with 26% in a very, very large cardiovascular outcomes trial. So we are excited to bring that to India as well. As I said, India has been part of many of our pivotal trials for semaglutide over the years. It's only fitting that we now bring this molecule also to Indians at scale, both with our own brand, but also with partnering.
Emil, thank you for sharing those insights with us and for joining us on Business Today. With that, we move on to other news and updates from across sectors. Stay tuned to Business Today.